This video will guide you on how to prepare for your upcoming ocular surgery as well as the do's and don'ts after your ocular surgery at University Malaya Medical Center. Before your surgery. Prior to surgery, it's important to maintain personal hygiene and keep your nails short and tidy. You are also advised to shampoo your hair the night before or the morning before your scheduled surgery. Hair oil usage is not advised. Patients who want to dye their hair should do it preoperatively as well. Avoid using makeup and cosmetic products on the day of your surgery and do not wear jewelry when you are coming for the surgery. Stop smoking 12 hours before surgery. You are advised to take all your medications, except for those that have been instructed to stop before your surgery. If you did stop any medication, restart these after your surgery after discussing it with your doctor. You can consume a light meal before the scheduled surgery if your surgery is at our daycare center. For those planned for surgery under sedation or general anesthesia, you will have to fast before your surgery, which will be advised upon admission in ward. You must come for the surgery with a caretaker or relative and bring along an empty bag to put all your belongings. The do's after your surgery. You may have an eye patch on the first day post-surgery. But fret not, as it will be removed the next day. You will be provided with an eye shield that is to be used for 1 week after your surgery, especially when you are sleeping. You are advised to use sunglasses when exposed to the sun, in order to avoid glare. You will be prescribed with eye drops that are to be used after your eye patch has been removed. In general, the eye drops are taken at intervals of 2 hours or as prescribed by your treating doctor. If there are more than one eye drops prescribed, wait for 5 minutes in between each application, so that you don't dilute the previous drop. Immediately after surgery, you are allowed to read or watch television. You should attend all scheduled eye appointments post-operatively. You may consume a normal balanced diet as there are no dietary restrictions after the surgery unless you have allergies. You might experience discomfort, grittiness and redness after your surgery. If you have severe eye pain, eye discharge, or sudden blurring of vision, please seek medical attention immediately by visiting our emergency department if it's outside working hours or visit our walk-in clinic during office hours. The don'ts after surgery. After cataract surgery, do not lie on the operated side, or in prone position. If you have undergone any other type of ocular surgery, post-operative positioning will be advised by your doctor accordingly. Please don't rub or touch your eye, especially for the first 2 weeks after your surgery. Avoid performing strenuous work and heavy lifting jobs, involving over 10 kilograms of load after your surgery until advised by your doctor. During prayers, you are advised to sit and slightly tilt your head forward rather than bowing down. Do not bend down to lift objects for the first 2 weeks of your surgery. You may kneel gently to pick things up. If you are having persistent cough and constipation, get yourself treated for it as soon as possible in order to avoid post-operative complications. Refrain from wearing any eye makeup for the first 2 weeks after your surgery. You are not allowed to shampoo your hair for 1 week after surgery. If you must, get it done in salon style or go to the salon to wash your hair. You are advised to avoid driving, gardening and cooking until given the clearance by your doctor. You should avoid any form of strenuous exercise and contact sports for at least a month after your surgery. Do not go swimming and avoid any other water sports for at least a month after the operation. Avoid visiting dusty and polluted areas after your surgery. Avoid crowded areas such as the market or the mall to reduce any risk of infection until advised by your doctor.